Which of the following is primarily responsible for maintaining blood flow and oxygenation during cardiopulmonary bypass? A. Oxygenator. B. Arterial filter. C. Venous reservoir. D. Roller pump. Answer: A. Oxygenator. Explanation: the oxygenator is responsible for oxygenating the blood during CPB. It replaces the function of the lungs, removing carbon dioxide and adding oxygen to the blood. The roller pump circulates the blood through the circuit, while the venous reservoir collects blood. The arterial filter removes any debris from the blood. What is the primary function of the arterial filter in a cardiopulmonary bypass system? A. To maintain blood flow. B. To oxygenate the blood. C. To remove gas bubbles and debris. D. To measure blood pressure. Answer: C. To remove gas bubbles and debris. Explanation: the arterial filter is crucial for preventing air emboli and other particulate matter from entering the patient's arterial circulation. It filters out debris and bubbles that may have formed during the bypass process. Which component of a cardiopulmonary bypass circuit is used to monitor and regulate blood temperature? A. Heat exchanger. B. Venous reservoir. C. Oxygenator. D. Roller pump. Answer: A. Heat exchanger. Explanation: the heat exchanger is used to regulate the blood temperature by either warming or cooling the blood as it passes through the CPB circuit. This is critical in preventing hypothermia or hyperthermia during surgery. During cardiopulmonary bypass, what is the role of the venous reservoir? A. To return blood to the heart. B. To monitor blood pressure. C. To collect venous blood and prevent air embolism. D. To oxygenate the blood. Answer: C. To collect venous blood and prevent air embolism. Explanation: the venous reservoir collects blood from the patient's venous system and holds it before it is pumped through the oxygenator. It also helps to prevent air embolism by maintaining a level of blood that ensures there is no excessive suction from the venous line. What is the significance of the priming solution in a cardiopulmonary bypass circuit? A. To increase the blood oxygen content. B. To reduce the risk of clot formation. C. To replace blood volume and prevent hemodilution. D. To warm the blood before it enters the patient. Answer: C. To replace blood volume and prevent hemodilution. Explanation: priming the CPB circuit with a solution, typically saline or a balanced crystalloid solution, helps to replace the volume of blood in the circuit, which would otherwise cause significant hemodilution and imbalance. It also helps maintain circulation during the procedure. Which of the following monitoring devices is most commonly used during cardiopulmonary bypass to assess the adequacy of perfusion? A. Pulmonary artery catheter. B. Intra-arterial pressure monitoring. C. Central venous pressure monitoring. D. Electrocardiogram (ECG). Answer: B. Intra-arterial pressure monitoring. Explanation: intra-arterial pressure monitoring is critical during CPB to ensure that perfusion pressure is adequate for organ perfusion. It helps assess the effectiveness of the bypass and the health of the circulatory system during surgery. What is the primary function of the roller pump in a cardiopulmonary bypass circuit? A. Oxygenate the blood. B. Maintain blood pressure. C. Circulate blood through the CPB circuit. D. Monitor blood gas levels. Answer: C. Circulate blood through the CPB circuit. Explanation: the roller pump is responsible for circulating the blood through the CPB circuit. It creates a pressure gradient to move blood from the venous reservoir through the oxygenator and into the patient's arterial circulation. Which of the following is a common complication during cardiopulmonary bypass that may require monitoring of the oxygenator? A. Hypotension. B. Air embolism. C. Inadequate oxygenation. D. All of the above. Answer: D. All of the above. Explanation: the oxygenator is a key component of CPB, and complications such as inadequate oxygenation, due to malfunction of the oxygenator, air embolism, or changes in blood pressure, hypotension, can arise during the procedure. Monitoring the oxygenator ensures that it is functioning properly. What is the purpose of monitoring the pH, oxygen, and carbon dioxide levels in blood during cardiopulmonary bypass? A. To monitor the patient's temperature. B. To ensure proper oxygenation and acid-base balance. C. To assess the function of the venous reservoir. D. To detect bleeding complications. Answer: B. To ensure proper oxygenation and acid-base balance. Explanation: monitoring the levels of oxygen, carbon dioxide, and pH in the blood helps assess the effectiveness of the oxygenator and ensure that the patient's acid-base balance is maintained during CPB. These values are critical for proper organ perfusion and recovery. What does the cardiopulmonary bypass pump do during surgery? A. Pumps oxygenated blood into the patient. B. Pumps blood through the oxygenator to remove CO2 and add oxygen. C. Controls heart rhythm. D. Assists in clot formation to seal blood vessels. Answer: B. Pumps blood through the oxygenator to remove CO2 and add oxygen. Explanation: the CPB pump is primarily responsible for pumping blood through the oxygenator, where oxygenation and removal of carbon dioxide occur. It helps maintain circulation when the heart is stopped during surgery.